Hello, everyone. Welcome back to class. This week, we're going to explore, or maybe in some cases for you, reviewing how to search the medical literature. So last week, we looked at the PICO. Let's blow this up a little bit bigger here. Again, just to remind ourselves, the population P, the more specific that we can make it, the better. For example, last year, a student in the program focused on biologics for children with asthma. Now, my assumption is there may be different treatments or different biologics that would be indicated for adults. There definitely would be, if we did a rehabilitation example, differences in rehab/exercise therapy progressions for a high school baseball player compared to a 45 to 65-year-old adult with shoulder pain. Intervention, again, the more specific, the better. Comparison, oftentimes the comparison, if it is a double-blinded, randomized controlled trial for a drug, is going to be a placebo. But you'll notice sometimes that the comparison is not a true control or a true placebo, but rather it is what the current standard of treatment is. Because again, it may be unethical to withhold treatment from a group. And finally, the outcome, again, the more specific that you make it, the better, or the more things that you include, the better. And so what do I mean by that? Well, for example, if I was looking at back pain, I might be interested in the reduction of back pain, but also interested in improvements in scores on those pen and paper outcome tools. So what is your question? Now, the PICO that you wrote up for week 2, that could be the topic of interest for you, or you may want to keep exploring. Your clinical question, though, this will serve as the foundation for locating relevant references or relevant publications for your review. When asking a question about an intervention, you are going to, again, need to be able to highlight what the treatment is, the outcome measures, and the population characteristics. A rehab example. So from my world as a clinician, I work with patients with acute low back pain. I would like to know the effectiveness of spine manipulation for the lumbar spine and compare that to other conservative treatments or to natural history. So my P could be adults 18 and older with low back pain, and I specifically put 16 days or less in there, so that would probably be acute to subacute low back pain, with no radicular symptoms beyond the knee. Now, why did I put that in there? I chose that specific because there has been some research studies that have looked at those particular parameters. The intervention being spine manipulation. The control, putting other physical therapy treatments or natural history. And so you can do that. You can have potentially multiple things in there. And there's a potential rationale for it because somebody may not be able to get in quickly to a rehabilitation professional. And so just seeing how they improve over time. Or maybe the studies were done specifically like that, where they were just told just to try to be as active as possible. Other physical therapy treatments could be like therapeutic exercise, massage, hot and cold. And then the outcome tool, or excuse me, the outcome being pain, probably a visual analog scale 0 to 10. Medical example, I have a patient with diagnosis X. I want to know if medication A is appropriate at reducing the severity of symptoms. Currently, medication B is used for patients with this diagnosis. So again, looking at the PICO, this is where you would want to make sure you're defining the population with diagnosis X using biologic sex, age range, and other demographics. medication A is the intervention. The obviously control would be medication B because that's the standard of care. And then the outcome being the severity of symptoms. So your PICO helps to inform your search. The keywords that you use may potentially all be included in your search. However, it is also possible that you focus on the P and I and maybe the O, and you review the titles and abstracts for the C. We'll get examples here. Here was a systematic review that I published in Sports Health. Sports Health is a journal led by orthopedic surgeons, physical therapists, and athletic trainers. And so what I was curious was looking at two different strategies of therapeutic exercise for individuals with low back pain. Now, the two different approaches, one was the motor control exercise approach, and the other one was a general exercise approach. And so my question here basically was, since I wrote, it's not known if one is superior to the other, I would have a P of adults with low back pain, an I being a general exercise approach for low back pain, the C utilizing the motor control exercise approach, and O being reducing pain or disability, and disability being measured by those different outcome tools. So you've got a question, you've got a PICO in mind. Using that example from earlier, what's the effectiveness of manipulation for acute low back pain? So what would be potential keywords? Well, I might try to use things like manipulation, spine manipulation, other terms like high velocity, low amplitude thrust, or maybe just the abbreviation, low back pain, and lumbar. Now, what you're going to find, though, is certain words may be really effective at helping to narrow your search. Certain words may be horrible, like low back pain. You might find 50,000 publications. So you've got to get in the process of knowing what words to use and how to combine keywords together to narrow your search. So keywords are key. What are the best keywords, though, for your topic? Well, some of those keywords may be things that are just natural. For example, the individual who was looking at asthma and biologics last year. Well, use asthma and biologics to see what comes about. Another person was interested in looking at the effects of lavender. So very easy to utilize lavender and pain, or lavender and mental health. So it's important to use your knowledge about your topic. And if you have a few key pieces of research, those research papers will have keywords on them. Those keywords are typically words that are different from those found in the title. Now, in this particular article, they have both shoulder arthroplasty and rotator cuff within the title and in the keywords. Usually the journal wants to have 3 to 5 keywords that are different than anything that pops up within the title of the article. And the purpose of all of these is to help to increase the visibility of the article when a search is performed. Here's another example looking at a paper from the Archives of Dermatological Research. Core competencies for dermatology physician assistants, knowledge recommendations from a national survey of dermatologists and physician assistants. And so again, interesting here that they put physician assistant in the keywords and within the title. This is interesting. Physician associate. Is that a common term? I don't know. I've not heard that one before. So performing a search. How many articles do you want to look through per search? I gave the example previously about low back pain. Massage is another good example. If you take a look at massage, the very top little snippet there from PubMed, 15,685 results. Now, it's very possible that many of those results don't have anything to do with massage. So it's time to try to narrow things down. Plus, nobody has time to go through 15,685 potential articles. Typically, 300 abstracts is a good cutoff. That's something to shoot for. So the next one shows massage and low back pain, and 380 results came up. So this is one of those areas then, if I was doing a systematic review or a scoping review, I would really start to think, do I want to go through all 380 or do I want to try to add another word in? And then that would come back to my PICO. Because as a physical therapist, I know that maybe the traditional massage techniques of effleurage and petrissage are the most commonly one done, but there might be other ones that are a little bit more alternative in nature. And so if I use words like effleurage or petrissage, I might be able to help ignore some of those. Finally, at the bottom there, I put in massage and return to sport. Let's say I was doing an article on the effects of massage for recovery or returning to sport. Really narrowed things down, got me to 13 results, making things extremely manageable. Here is the table that I published in that paper from Sports Health. The search strategy by keyword and the number of identified and relevant articles. Tables like these are going to be important because, one, we're going to want to have a table like this within your dissertation. And two, again, hopefully you're thinking about publishing your findings. Most journals want to have this in that. This is a quantitative presentation of your search strategy. Basically, it highlights to people, hey, did this individual appear to cover everything that they needed to cover? Did they search for everything that was necessary? And so you can see that a few of my different search strategies had some really large identified number of articles, like motor control exercise. Okay, very wide open there. It could be more than just low back pain, because obviously when I added low back pain in, it went down to 33. Therapeutic exercise and low back pain, 837. I didn't want to search through all those. And so I started to come up with different terms that I would know that might reveal an article. Or as I started to find articles, I could look at the keywords and see if there was a keyword that I hadn't included previously. Now, you're going to have in your table for your homework assignment an identified and a potentially relevant column. We're not going to have an in critical appraisal column at this time. Why? Because you're not writing anything at this time. You may want to, if this is a topic of interest for you, have two, do the in critical appraisal. Well, no, don't even worry about doing that at this time. You can come back to that at a later time. The whole purpose of the in critical appraisal is to illustrate, if we go back a slide, that as I go through things, how many articles I found that were potentially relevant, and then I'd review the abstracts and the titles, and then I would include 8 of the 17 from the general exercise and low back pain search. Also, I'm highlighting duplicate results found. Again, it's just another way of kind of quantifying the search process. But again, we're not going to be, when you turn in the paper, listing in your critical appraisal, because we're not doing that, not at this point in time. So now let's talk about defining your search strategy. We've been kind of doing that already. Ultimately, when you when you do write your dissertation, you're going to include text within your methods section that is going to describe your process and the types of studies that you include in your review. So I wrote here that for this particular systematic review, this is a different one, looking at patellofemoral pain and the use of hip strengthening exercises. And then I highlight that if a search term generated more than 200 articles, additional searches were performed. When fewer than 200 articles were identified, abstracts were reviewed to identify relevant articles. And then I identified the specific articles that would be included. So in this particular systematic review, we allowed randomized controlled trials, quasi-experimental designs, prospective epidemiology, case control epidemiology, and cross-sectional descriptive epidemiology. Now, we were able to publish this as a systematic review. Yes, you can do systematic reviews that way. But again, I think this would have been better. This is a much older thing. I think this would have been better if we had called it a scoping review. Systematic reviews, I think it'd be best if you focused on randomized control trials, because if you can find 8 to 10 randomized control trials, well, that's really meaty. That's got a lot of stuff to it. But if you're going to be doing your scoping review and your scoping review has maybe a couple randomized control trials, but then there's a variety of different studies of lower value on the hierarchy, then we should make it a scoping review. Notice that I also write, in addition, the reference list of each selected article was reviewed to identify other relevant publications. This can be a valuable thing, a valuable way to find articles sometimes, because it's very possible that something was published in a journal that maybe is not on CINAHL or Medline at this time. Here's another example, something from, I can't remember what the article is. It's not something that I did, but let you go ahead and read through this here just to highlight that instead of saying the word keywords, they used the term mesh. And MESH stands for medical subject headings. So I'm going to give about 5 seconds of dead air. I'll invite you to pause the recording, read through this just so you get a flavor of it. Okay, I'm assuming that you had a chance to read through that. We will move on. Okay, so what is this slide talking about? This week we have assignment 1, and you can redo how I've got it set up here. Let me pull it up. So what you'll find on Canvas is this handout. And if you want at this time, you can just utilize this format, type in the keyword or keyword combinations, the identified articles, and potentially relevant articles. So feel free to use that at this time. Or if you'd like, you can make it a more formal table. This formal table is not required at this time. So that's what this slide is saying. So one recommended strategy for conducting a search of the literature, look for articles that are directly related to Major focus of your project. Again, review titles and abstract before downloading. Establish a list of criteria for selecting the articles, the databases searched, key terms or keywords, or those medical subject headings, and the dates of the review. So, things may move really fast. For example, biologics, you may only want to look what has been published in the past 3 to 5 years. However, if you're looking at lavender supplementation, maybe you want to go back 10 years, 15 years. So understanding the literature, understanding how active that area is important. You wouldn't want to maybe include studies from biologics going back 10, 15 years because those may not even be in use anymore. Now, a rule of thumb, review literature that's 5 years old and classic studies. Now, what I mean by those classic studies, well, there may be particular surgical papers, and that same surgery is done, even though it's performed in the same way, even though that surgery paper was 10 years, 15 years old, it may be a very large randomized control trial, something very important that you would want to include. So again, review abstracts of the articles and organize them into categories as potentially relevant and articles to include in the literature review. Again, this week, you're only going to be including the identified articles and potentially relevant articles because the articles to include in the literature review, that column wouldn't be created until you start writing up your dissertation document. So the George Fox Library, get into it, click on databases A to Z, then click on C. Right there, click on C, that's going to take you down, click on CINAHL with full text, and then you come to this, so you see CINAHL with full text, also then click on choose databases right next to it. Now, CINAHL with full text should already have a check mark in it. I want you to scroll down and click on Medline. Probably 99% of anything that you would need would be within CINAHL and Medline. And why do I say 99%? Well, for example, in the physical therapy world, especially sports rehab or maybe sports performance, there may be things within the sport discus search engine. You may be wanting to do something within treatment for patients with certain psychological conditions, anxiety, depression. You may want to also review the psychological different search engines. It's important to keep track of which search engines you looked at because you'll include those within the methods of your dissertation. Okay, now scroll back to the top. So again, you clicked on Medline here, scroll back to the top and click OK. And as I said before, CINAHL and Medline should cover 99+% of all journals that you might have an interest in. If your future topic includes sports, consider adding sport discus with full text. And like I said before, if your future topic involves mental health or psychology, utilize that search engine. So again, what is your question? As a physical therapist, I might be interested in rehabilitation programs for patients with primary idiopathic adhesive capsulitis, aka frozen shoulder. I know from clinical experience that PTs will often use exercise and manual therapy techniques. So I'm curious what works best. So now if I typed in primary idiopathic adhesive capsulitis, I got 14 results. Well, that seems really small, and that's why I say keywords are key. If I go with primary idiopathic adhesive capsulitis or frozen shoulder, it explodes up to over 3,000. If I put frozen shoulder in physical therapy, it narrows things down to 606. Again, the rule of thumb is to try to get below 300. And then some additional combinations. Frozen shoulder physical therapy and randomized controlled trials, just 13. Frozen shoulder manual therapy, randomized controlled trials 7, and then finally frozen shoulder exercise and randomized controlled trials 12. Here, looking at frozen shoulder and physical therapy, 46, and then frozen shoulder and therapy, 90. Again, just trying to explore different things because you're trying to cast a wide net to make sure that you cover your bases. Now, here is maybe something that would really help you kind of think about if you wanted to do a systematic review or a scoping review. So I had previously talked about randomized control trials here. And maybe I'm thinking, maybe is there some other good studies out there that I'd like to include that I'm not capturing, so I'm exploring some different things. Well, what about quasi-experimental? Boom, over 4,000. Now it's getting overwhelming. Now, if I wanted to do a systematic review, I should just focus on the randomized control trials. If I was wanting to do a scoping review, I would need to really work and massage the keywords. And so what do I mean by that? Well, frozen shoulder here in randomized controlled trial and quasi-experimental, that could include medical provider treatments. That could include prescription medications. That could include surgical procedures that only had a pre-test, post-test, and no control group. So you can see how it can get really overwhelming or challenging. So your homework, you're going to have your keywords, your identified articles, and potentially relevant. And again, don't include the quote in critical appraisal, unquote. Choose a number of articles that you would accept for a keyword search to review for relevance. So define that. Is it 200? Is it 300? For something that's less developed, maybe like lavender supplementation, maybe 100 might be appropriate. And then instead of submitting to my GFU email address, submit in Canvas. There's a way to upload it there in this week's section. All right. If you have any questions, please reach out. Otherwise, have a great week.